Okay, so this is my very first time recording a video for YouTube. Welcome. Um, Low-key, I wish y'all were here from the beginning when I was first starting out with makeup, but only because what I'm doing today, it'll really look like I done transition. But we won't worry about that right now. So, anywho, this is a wig that I made, so that's why I'm like staring at it right now. I'm gonna fix that once we finish the issue at hand. So today I want to talk about fibroids. My passion. Okay, so I'm a nurse practitioner, right? Which means I went to school for a while and I might know what I'm talking about when it comes to health. I don't know, just a little bit. So I'm a nurse practitioner and I'm in a specialty right now. I'm in hematology and oncology. Blood and cancer basically is what that means. I don't know a ton because I work with the best doctors that I have ever met. I cannot ask for a better group. So I'm just gonna, my passion is making sure that the community knows just a little bit of what I know, because I run into patients every single day that have no idea because they're being talked at and not really being talked to. And so that has always been my passion, even before even starting any of this. And so that's really the basis and motivation for this channel, is because one, I absolutely love makeup. I don't claim to be an MUA whatsoever. I have never been paid. Let's get that clear. I've never been paid to do anybody's makeup, first of all. Second, I absolutely love talking about healthcare. Like, if we start talking about it, I can go on and on and on. But anyways, and so not only that, but you will not believe how many times I've gone into a patient's room. I primarily work in the hospital setting, but you would not believe how many times I've gone into a patient's room and I will just sit there and talk to them, break things down for them, and they'll say, "You're the first person that has broken that down for me." I'm like, "Are you for real?" I mean, I don't say that, but I'm just thinking it. I'm like, oh my gosh, like, ma'am, sir, you've been here for 6 days and I'm on day one seeing you and you're just now saying, "Thank you for breaking it down." That's a problem in healthcare. I mean, I'm just saying, I'm gonna keep it real. That's what y'all gonna learn about me. I'm always gonna keep it real, no matter what. Again, because I'm not getting paid to do this. I'm just trying to help somebody out. Again, my basis for doing any of this is to help you out. So anywho, so I'm discussing fibroids because in the African American community, Black women are 2 to 3 times more likely to have fibroids. And if y'all hear that squeak noise, I'm sorry, that's my chair. I get to move it when I'm passionate about something. So, anywho, shout out to my twin sister, my older sister. My twin sister is line sister. Like, I know so many African American women that have fibroids right now that it makes no sense. Where do they come from? Why are they there? How do we treat them? When should we go to the doctor? Like, there's so many questions that I want to address. Like, what are the risk factors? What causes them? What makes them worse? What makes them better? I mean, there are just so many things that nobody really talks about. And so I have been feeling like this for so long. Like I said, before I even graduated grad school, again, I'm a new nurse practitioner, but I am proud about it. Graduated in 2018. However, you got to learn a whole lot. You can Google a whole lot, but when I tell you, when you have multiple patients that deal with a whole lot of things, that's the best experience you could ever get. You pay tuition, you can Google, you can research, whatever, but experience will always be the best teacher. So, anyways, now let me give you an example. My older sister, she has no issues with discussing these things. I'm gonna bring her on a video maybe another time. But right now, let me just use her as an example because she don't care about HIPAA. We share the same blood, so I have permission to do this. But I'm going to be doing my makeup at the same time because, like I said, makeup and medicine, those are the two things that I can talk about all day long. And I'm okay with that. And so, why are Black women more susceptible to fibroids? That is something that I don't know the answer to personally. And I will tell anybody this. Science and God, they never intertwine, but for some reason we can never find the finite answer for either of them, if that makes sense. And so we're gonna do these brows right now. And I want y'all to know, like I said, I've never been paid to do makeup, so I'm gonna do a simple look because I mean I can make myself presentable. You know, I can do a little something. But my older sister, her name, Amber Michelle, I love her dearly. And so I went to her surgery with her because she was just like, oh my God, I'm just not feeling good. I need to go to an OB-GYN. Something's not right. And so she went to a doctor, and the doctor was like, okay, well, we're going to do this exploratory surgery. We're going to see what's going on in there. She was like, okay. So at that time, I was working as an RN. So I was like, okay, I got that day off. Perfect. I'm going to be there for your surgery, you know, because that's what family does. You're there. And so I showed up, waited in the waiting room. And so I went back there. You know how the doctor comes out and was like, oh, I want to talk to the family. So I came out there, whatever. If my brows look at a mess, that's fine because I always just outline them first before I go doing anything fancy. So anywho, so I went to go talk to the doctor. It was me and my mom and my older sister's husband. So we went out there, got to talking to the doctor. She's like, she had large fibroids, so many of them. It makes sense why she was having so much abdominal pain, bloating, weight gain. I want y'all to follow along with me because I'm giving you some of these symptoms as I'm, you know, because I have an actual specimen or human being or example to go off of. Like, oh my, says she has so many symptoms, or excuse me, so many tumors or fibroids that she just, it makes sense why she was having all of the issues she was having, which is very messed up because I'm like, you know what? Again, I feel like Black women, we deal with a whole lot. Like, I don't know if it's because we feel like we gotta be strong or what that issue is. But our pain tolerance don't make no sense. And so I'm like, Amber, how long were you dealing with this? She was like, oh, I've been dealing with it for a while. I'm like, girl, nobody's making you deal with this. So, anywho, just to wrap it up, doctor's like, so it makes sense why she was having months, almost years of pain, bloating, weight gain, painful. I mean, I don't know if she had this. We don't talk about this. painful intercourse. If you're having painful intercourse, it's kind of like I said, I don't know if my older sister was having that, but that's one of the symptoms of large uterine fibroids. Leiomyoma. Look it up. Uterine fibroids. Why are Black women so susceptible? There are so many reasons, well, speculations why Black women have more uterine fibroids than anyone else. Low vitamin D levels, what have you. They even traced it back to possible sexual abuse. That's a topic for a different day. I don't know why, but I know so many Black women with uterine fibroids, and that is an issue for me. Like I said, I'm so passionate about healthcare, and I will never understand why this is such an issue for us. I want y'all to realize these brows, there ain't nothing special. I should have done these off camera first, because I'm not a fan. But we're going to make it do what it do, baby. I remember when Jamie Foxx said that on that song. I want y'all to know I'm random. I love to laugh. That's just me. We're not going to talk about this wig looking popped, because this is the wig that I made. It's a closure wig. Look at that mess. Anyway, so these gonna have to do. Let's throw some clear brow gel on there. Looks good enough. So, anywho, let's do a quick eyeshadow look, because I mean, that's just what it is, you know? I'm going to be using my Jaclyn Hill palette. Shout out to this ring light my husband got me. So, like I said, I want y'all to leave some comments, concerns, questions in the comment section, because, like I said, I have no problem with getting personal with you. Like I said, I'm a nurse practitioner. I get all in your business for a living. But it will never leave us. I pride myself on that. I will never discuss a patient's business on this channel, or ever in public, or ever in silence either. I mean, I'm just saying. So, if y'all want to send me a private message, that's fine. I need to create an email so that we can have some discussion back and forth. And so, let's try some color today, y'all. I'm going to try to be brave. I do not do color. My husband is a Kobe fan, so when you see this purple, just know that's why I'm trying the purple. Is she cute? I hope it looks purple for y'all, not navy. You know how the cameras are. So I put this on the outside, work it up to the crease. Again, I'm not a professional. Have never claimed to be. But y'all gonna get this work today. Just saying. Oh, Jesus. The Fenty done fell. Father God, help us, Lord. Okay. So there's the Kobe. Oh, that's so sad. Moment of silence. Like I said, my husband was the absolute biggest Kobe fan I have ever met. Is the absolute biggest Kobe fan I will ever meet. Y'all, my baby's name is Brian. I, I, I have been talking about that since day one. Like, I feel like my husband and I have known for so long that we were going to name our firstborn Brian Kobe. So I'm like, oh my God. I'm like, you lucky. I don't mind. Why am I so extra? I don't know. But anywho. And so anyways, so we named our baby Brian. We will discuss the struggles and everything leading up to that pregnancy, my first pregnancy, another day, because, baby, a mess. So anywho, so here I am going to put on my foundation. This is the Lancome Tint Idol Ultra Wear, and I am in the shade 450 Suede N. Come on, baby, where's my foundation brush? I have a flat kabuki brush that I'm looking for. Oh, there it is, right here in front of my face. And so I'm just gonna do 2 little pumps, because their pumps aren't as big. Those are 2 small pumps. So anywho, here we are. So now, like I said, they try to say, when I say they, I refer to the science world. They try to say that African American women don't take in enough vitamin D. That might contribute to fibroids. In my mind, I don't know. I feel like we are a very, very in tune culture and people. Like, oh, okay, if we're lacking vitamin D, duh, we take vitamin D. That's something that I also want to address on another video for another time. Labs. We will discuss that at another time, because like I said, I am looking ugly applying this foundation. That is fun. And this is supposed to be gold on my inner eye, but it looks silver on camera. I promise it's gold, but we're gonna make it look cute regardless. So that's foundation. Throw on some concealer. This is my Tarte Shape Tape Concealer. Let's see, damp sponge. We gonna make this do what it do. Y'all, when I tell y'all, I did a live video earlier and I'm like, oh my God, why do I keep making these ugly faces? I can't even tell you why. Ooh, Lord, that's my summer. Excuse me, this is my winter concealer. Not bad. I know I'm looking a little bit like light skin Michael Jackson right now, but we're gonna fix it. I dropped my oh nope, here we go. This will work. So this is my Makeup Revolution setting powder. This is the banana one. I ran out of Laura Mercier, but I'm telling y'all, this is a really good, affordable drugstore version. Like, so I'm just applying that to my under eye. Again, let's get back to medicine. Oh my gosh. Oh my God, I'm back at it again. I'm doing this in one take, so y'all gonna have to bear with me. The most random person y'all might ever meet. And I'm okay with that. Like I said, I could talk makeup and medicine all day long. You can inbox me, email me, all of your questions. If I don't have the answers, trust me, baby. I research, I will find it out for you. And sometimes, even if I don't have the answer right away for you, I'm very good at just contemplating things and figuring it out. Because that's just how I am. I gotta think of the stuff to figure out the things, and I'll get right back to you. Because again, with me being so new, I know some stuff. I just gotta let it process for a little bit. And don't worry about this yellow looking face. We're gonna fix it. So we did the contour. Oh, no, we didn't do the contour. My brain is working faster than I am. So I'm not gonna do the contour just yet. I'm lying. My MAC Studio Fix. We're gonna knock all of this off. Okay. Now we're gonna do the contour. But before I do the contour, let's fix these trash eyebrows. So this is my True Complexion Black Radiance. I don't know why I start to call it a Pure Radiance. This is gonna be a quick video because again, so then we're gonna slightly contour the nose. My oven going off. I call myself on this little diet, trying to make my lunch for the week. This is still that Pure Radiance, or excuse me, Black Radiance contour palette. Now I'm just doing my e.l.f. blush palette. I'm doing this brick red one. I love this ring light my husband got me. I wasn't even thinking about YouTube videos when he got this. I was like, now you know my anxiety is through the roof. Why would you give me a ring light? Sir. He was just like, because you love makeup, do something about it. I'm like, And this is my Morphe highlighter palette. Hope y'all can see this. I'm mixing like a couple of shades. So this is my Morphe highlighter palette. I use these two. You won't be able to see it right now. I don't know if I got my lighting up too high, but trying to turn down just a little bit. Maybe y'all can see me. So after we do all of that, that is when I do my setting spray. It looks like it's in this miniature Urban Decay all-nighter, but it's not. I just love the size of this itty bitty little bottle because it fits in my makeup bag. But I've been using this Cherry Blossom Max Prep and Prime, and that's what's in there currently. I'm such a ratchet makeup person, but if it works in the end, I don't care, like, and that's fine. Again, y'all will not see me, like I've told another group, y'all will not see me add highlighter, like this highlighter, to this big old forehead, because no. But we're about to finish this look. Like I said, I am absolutely in love with makeup, medicine. I may even discuss wigs, hair, whatever, because like I said, I made this wig hand sewn. And that's just that on that. So we're gonna do highlighter. I always try to, we're not gonna do any lashes today because we just aren't. I'm gonna make this a simple look. Like I said, when you do this every single day for work, you can kind of speed up. I know. Oops. Y'all ignore that. My hubby trying to get. And so, sir. And so, we're gonna call this good. I was gonna do my lips, but let's see. I'm gonna still do MAC Cork. This is my go-to lip liner. My husband is getting on my nerves, y'all. We're gonna leave that aside. So this is Ophelia by Kat Von D. We're just gonna, it's a nice neutral shade. Alrighty, so that's that. I have no earrings in whatsoever, but again, like I said, we're gonna work on this makeup look. So anywho, Fibroids and Foundation, that was the title of my very first video. Y'all send me emails, messages, whatever, and we can discuss. Next video soon to come. Love y'all.